today?
One minute I'll be fine, the next minute I'll just be laying on the floor and then I'll lose consciousness as well.
I lose sensation in my fingers, sometimes my lips as well. That never used to happen when I was younger.
I just wonder, has there been kind of pus at any time as well?
Now it's more like some sort of thick, smelly pus-blood mixture.
Is it tender when I push on the chest wall here? Fine.
That's it, it's all.
Okay.
I'm going to give you some naproxen for a couple of weeks.
Oh, yeah.
A small dose, because you are 88.
Tell me about it.
Look how yellow that is. It's meant to be like really clear, isn't it?
Not clear, it's meant to be a light yellow.
It's like orange.
Reese,
Oh, yeah.
Hello, Kelly.
Oh, back with this one now.
Hello, how are you?
Sit there. Give that
Right.
to the doctor.
Oh, thank you very much. I get all the nice presents.
I know. We were sitting there holding it.
So, what have you had done? He's had some surgery, yeah?
Yeah, he had a circumcision. He's had problems with his peeing for like the last couple of years.
And so they did a circumcision.
Yeah. Took the foreskin off, hoping that that might help the pee flow, but it hasn't.
Okay, so the pee flow hasn't got worse since
Yeah,
the
it
surgery.
has.
It has got worse. Is it hurting him to pee?
Yeah.
And before he had the circumcision, it was the same sort of thing.
Yeah.
Lots of trouble passing water.
Yeah. And last night he was up and down and he's pushing and it's not coming out.
Is he opening his bowels?
Yeah.
He's not constipated.
No.
Because if he's constipated, that can cause problems with emptying your bladder, no?
No. You go every day, don't you, for number 2?
Yeah? OK, let's have a look at you then. Can you climb up onto the couch for me, sweetheart?
He drinks a lot as well.
Oh, wow. That's impressive. I don't think I could get all the way up there.
Hello, thank you for waiting.
That's okay.
Have a seat. And Dr. We've met on the phone, haven't we? We haven't actually met.
Oh, yes, that's right, yes.
Hello, nice to meet you.
It's nice
Hello,
to meet
hi,
you.
have a seat.
I've been having trouble with my ear for the last 7 weeks. I did see Dr. Shah and she gave me some drops which actually made my ear worse.
Okay, so
It's been bleeding.
Right.
It's been very itchy and very sore.
And the drops she gave you didn't help?
No, they never do.
When you say they never do, is this an ongoing problem?
Oh, yes. I've been to the hospital and everything about my ear and it is an ongoing problem.
And what do they say the problem is?
Well, they said it was something to do with my jaw, but I don't agree with that. I think
Okay.
it's something to do with my ear.
So how long has it been going on for, this trouble?
Oh,
Years?
since I was a child.
Oh, so
yeah,
so just a couple of years then, not that long. Yeah. Okay. Let's look at the ear that's not trouble then, yeah. Is it going to hurt if I touch you? Does that hurt?
No.
Does that hurt?
No.
No. It looks okay. I can't see any bleeding. I can't see any sore. It looks a little bit sore compared to the other one.
Yeah. It's not been pouring of blood or anything.
Right.
It's just been like bits.
Do you
of
clean your
blood.
ears? Because they look really clean. Do you use cotton buds?
Yeah, but I don't go all the way in.
Yeah, you shouldn't go in at all. They're
No.
too clean.
Yeah.
That's the problem. The wax is there to protect it.
Yeah.
And I would urge you to not put any cotton buds. The best you should do is get a flannel or bit of tissue and just wipe your ear.
What it is, it's because when they were itchy, I put the cotton bud in.
And you scratch it.
And it's an itch where you can't get out, and it's really
I understand.
annoying.
So what happens is you get the itch, you scratch it with a cotton bud, which damages the skin, which makes it more itchy, so you scratch it even more, and it makes it worse, and it makes it it's bleeding, You got any moisturising cream or something?
No.
Just something to just put in it, to just dab it on there,
Oh, okay.
and it might just ooze the itch. But don't go sticking it down or anything.
Because I thought the itch would be further down the ear.
It's probably it's probably quite near the outside.
Oh, okay.
Yeah. And that will just then the cream might soothe the itch without you putting anything in it, without you scratching it.
Okay, thank you very much.
You're very welcome.
Doctor.
Thanks for coming in.
All right,
nice to meet you.
Doctor.
Bye-bye.
Bye.
Pull down for me, sweetheart. No, that looks okay, doesn't it? nice and tidy. Does that hurt, sweetie? No, a little bit. What we were worried about was whether or not there was urine stuck in his bladder there. There's no urine there. You can see how my fingers go right in. His tummy would be really hard and you would feel the bladder.
But he goes up and down, and he's not sleeping.
Absolutely. Come back
So
across, darling.
he's tired in the morning when we have to go to school. He's shattered. And he's not sleeping till 12 o'clock. He goes to bed at like 9. And he's up and down, up and down.
Right, so I don't think that there's any urine stuck in there that isn't coming out, but obviously it's not right.
Yeah.
Looks a tiny bit red, but not obviously infected, but there's some white cells and some protein in his wee, so it may well be that there's an infection higher up and that's what's causing his problems. What we're going to do is send that off to the hospital.
Yeah.
And we're going to give him some antibiotics.
Yeah, that'd be lovely.
Lots of fluids to keep drinking. You're giving him some paracetamol for when it hurts?
Yeah, Calpol.
Perfect. OK. Is Reese allergic to anything? Is there anything he can't have?
No.
Now, if at the end of it he's not right, we want to see him again.
Yeah.
If the sample comes back showing he needs any different antibiotics, we'll be in touch, OK?
Yeah, and in the meantime, if you finish the antibiotics and it's still no better, we
bring him back. Yeah? There you go, Reese. Do you want to take that off to the chemist?
All right.
Good boy.
What'd you say?
Thank you.
You take care, OK?
Thank you.
No problem. Bye-bye.
This way, chemist, this way.
I blame it on the not running. As soon as I cut out the exercise, I've just gone, I need to get back into it. It's Saturday morning.
Why can't I enjoy it like that?
What?
Running.
Oh, I run weird. You know, like Phoebe, your friends. Literally, watch.
Victoria says Panska, please. Come in, take a seat. How can I help today?
Yeah, yesterday she told me when she take her right hand up,
yes,
in breast side, she feels something hard and pain.
Uh-huh.
You can show, doctor? Come.
Any lump or is just painful?
And I feel something hard.
Okay.
Like something like, for example, like stone or something.
Okay, all right.
Show what you feel.
Can you show me what you feel? Is it painful? How did you notice it?
Yesterday when she's sitting in the room, she just put like hand. Sometimes she like put somewhere hand evening, and she told me she feels something hard, and when she touch, she feel pain.
Okay. Anyone in the family with breast problems?
My mother-in-law.
Mother-in-law, so her grandmother, yes?
Yes. Mm-hmm.
And what's the problem there?
She got breast cancer.
Okay.
There is this pain on my left knee.
Left knee. When did that start?
About 2 weeks ago.
Uh-huh.
It gives me a feverish condition.
It's making you hot?
Yeah.
Arms to the side as far as you can go. So that's very good. And go to the front, all the way up. That's good.
Keeping this leg straight, lift it up for me. And drop it back down for me. And the other side for me. All the way up. Okay, drop it back down for me.
What happened then?
I was ice skating, did a funny twist, went right down onto my knee, and as I did, I went all the way around like this.
And you've never had any surgery, keyhole, nothing on that knee?
Bad hand, bad knee, 2 knees, so I tried cycling and just to lose weight, and then I fell off, so that wasn't a very good start.
Tell me about your knee and what's been happening with it.
Well, it started off, I had a car accident about 10 years ago.
Yep.
And when the vehicle turned on its side and my leg was sort of took all the brunt of everything, I got a little bit of swelling, but then it always went down.
Yep.
Never had a lot of pain.
Okay.
Anyway, I was playing football, twisted it.
Yep.
And then, I don't know if I was, because it was twisted, I was putting a lot more pressure on this, but then it came up, but as it did before, it didn't go down this time.
Okay.
And then
So
I
it
started
stayed up.
And I keep getting quite a bit of pain in it.
Does it ever lock on you to the point where it sticks and you can't move it? You know? Does it click or clunk?
Yes.
Yep. Okay. Do you ever try and take anything for it to help it?
It's the usual stuff like the ibuprofen and...
Okay. Pop your shoes off, pop your socks off. Come and have a lie there. Okay. Head back, nice and relaxed. Don't go to sleep. Okay, so this is the good one. So there is a difference in size. There is, isn't there? You know, doesn't feel any difference in warmth. You've got a fair bit of fluid in there. It's a big difference between the two. Okay, let's bend that in. Bend it out. Bend it back in again.
Yeah, just a bit of clicking.
It's clunking and it's clicking and all sorts of things there, isn't it? The fluid does come into, this is called your suprapatellar pouch. When you get fluid within the joint, it sort of goes into there as well. So you can feel pain across the front here as well, but also down on that. The last one I'm going to do, I'm going to press down on that kneecap. I want you to squeeze these muscles really tightly and try and pull the kneecap upwards. So nice and relaxed. Off you go. What's that like? Yeah. It's quite painful. And again. Is that the pain you get?
Yeah.
Right, okay, hop up.
Can I even get a sweep?
Sorry?
Can I even get a sweep?
No. A couple of things. You've got something going on in the joint. You've had an X-ray, but years ago, haven't you?
Yes.
I think we need to do another one. Okay. Even then, you had sort of mild arthritic changes, okay, including a change behind that kneecap. Now, that kneecap's really irritable at the moment, okay? Remember when I pushed down on it and it pulled up? You know, that's scraping the bottom side of that. So I think you've got a fair bit of inflammation going on behind there. And undoubtedly, I think within the knee, because you've got plenty of fluid in the knee too, okay? So I'm going to send off a referral form for a knee X-ray, okay? It'll take a week to get the result.
Thank you very much.
Okay, mate.
Happy days.
Good to see you.
Likewise, my man.
Take care. And let's avoid the vet.
Hey. See you again.
See you later, buddy. Bye-bye.
It's that, isn't it? Yeah. It's very hard, isn't it? Okay, good girl. Now put your arms all the way up. All right, so what we'll do is refer her to the breast clinic and they can check that out for her. It's quite firm. It might be part of the rib bone potentially. Sometimes you get cysts and things, but I don't think there's anything worrying. I mean, she's only 9 years old, but we'll just get it checked out.
Okay, fine.
Is that okay? So you should hear from the clinic. Usually takes a couple of weeks. They're usually quite fast.
Yes, no problem, no problem.
We'll just get it
We can
checked.
wait.
Okay?
Okay.
Lovely.
Thank you. Bye-bye.
Bye now.
My back hurts, Gergen.
You know what I've done? I've made a mistake.
Gergen made a mistake?
Yeah.
No! I better write that on the calendar.
I know.
Gergen made a mistake.
I made a mistake.
Naughty girl. My back's killing me. Oh.
Hiya. Thanks for waiting. I'm Dr. Tawana. I think you've just recently registered with the practice, is that right? Welcome. How can I help?
Two things. First, my feet. Ingrown toenails on both big toes.
Sure, sure. Do you mind if we take a look? How long have they been troubling you for?
They've been steadily getting worse, so it's hard to say when they got as bad as they are.
Goodness.
On the order of a year, certainly.
It looks quite red and sore at the moment.
Yeah.
I just wonder, has there been kind of pus at any time as well?
Definitely this time last year there was. Now it's more like some sort of thick, smelly pus blood mixture.
And is it the same kind of picture on the other side as well?
On average, this one has been worse in the last couple of months.
Short term, what I think it requires is a course of antibiotics, okay, because of that kind of bad smelling discharge that you were describing. Yeah. Moving forward, I think it needs a referral to have some minor surgery done. Are you allergic to any antibiotics?
Not that I know about.
Okay. Given that this has probably been rumbling for quite some time, I think it may benefit from an extended course of antibiotics. So we'll give you 2 weeks worth. Let's do that referral to the minor surgery GP here. You mentioned something else as well.
Yes. The other thing is I've been recommended by my firm's occupational health to start seeking, diagnosis first, then treatment, regarding stress, depression and/or anxiety.
Physical problems can certainly exacerbate mental health conditions, and there is lots and lots of evidence available to suggest quite strong links between, for example, patients who suffer with chronic pain and who are also suffering from depression and vice versa. What made them consider that that might be what's going on?
What made them notice was persistent lateness.
OK. OK. What are your thoughts?
I would be inclined to agree, not because of the lateness, but I've been finding it really difficult to do anything. I mean, obviously leaving for work is one of those things, hence. But even things that I'm theoretically going to enjoy it's like there's a huge energy hump before I can get going.
Get going. How long have you been feeling that way for?
I'm not actually sure.
OK.
How can I help you today?
Ever since I was about 14, I've been suffering with migraines, on and off. I mainly put it down to puberty. I thought, like, my dad suffered at the same sort of age. Then they sort of seemed to clear up late teens. But I've just got back from holiday a week and a half ago, and I've had 4 in the last 2 weeks.
Oh, right.
And that's never ever, that sort of frequency has never been a case before. So
Can you describe the headache for me?
it always starts off with a flickering in my vision.
Yeah.
And that gradually expands into quite a large blind spot. I lose sensation in my fingers.
OK.
I think it's dependent on which side the headache's on as to which hand, and sometimes my lips as well.
OK.
That never used to happen when I was younger.
So what you're describing does sound like migraines, but it's become more severe. You just need to get you to do a few different movements with your eyes to start with. So can you follow my finger with your eyes, but keep your head still, and tell me if you get any blurred or double vision. Follow it up. And then all the way down. Any trouble? No? Can you feel me touching you? Is it about the same on both sides?
Yeah.
Yeah. Can you hear this rustling noise?
Yeah.
On that side?
Yeah.
Yeah. Can you stick your tongue out? Yeah, that's fine. And can you screw up your eyes and stop me from opening them? That's fine. OK. I just want to have a look at your eyes as well. Would you mind turning the light off for me? So I'm just going to walk quite close towards you with this light. Try not to look directly at the light. OK, that's fine. I think it would be worth getting an eye test if you've not had one in a couple of years, just to make sure. I suspect that these symptoms are related to the migraine, though, that you've described.
Yeah.
I think, at the moment, it would be worth giving you the preventative one. Do you mind just popping the light back on for me?
Yeah, I thought it was a bit dingy.
OK.
Thank you very much.
Take
Cheers.
care, then.
Have a good day.
Bye-bye, you too.
How are things like sleep, appetite?
Sleep is less than 8 hours a day, probably 6 on average, and I am way overeating. I'm always hungry.
Yeah. And then stress?
Honestly, I don't know how I would tell. How much frustration and anger is a reasonable response to life. Those are the 2 emotions I'm really capable of feeling all the time.
Yeah. Any reasons why you're feeling that way? Things not quite right at home or at work?
Things tending not to go to plan at work, that sort of thing.
OK. From the symptoms, I think, Graham, there certainly is that suggestion where perhaps you're kind of not getting enough sleep, you're perhaps not waking up refreshed. It takes you a while to get that oomph and that get up and go. And then having that kind of, perhaps that frustration and anger that you've mentioned, they point towards a diagnosis of depression. But what about other things that give you kind of enjoyment?
I'm a tabletop war gamer, a Warhammer player. And when I can get over myself and get in to go and play, it's fun while it lasts, if you see what I mean. But the minute I'm gone, I've forgotten about it. It's like returning to work after a holiday.
It can be really important to encourage patients to focus on the positive aspects of their life and encourage them also to do exercise, enjoyable activities, because it's been shown that this produces serotonin, which is our body's happy chemical. We fit into the equation here by saying to patients, look, there is the option of an antidepressant medication. And the final option would be talking to someone about your emotions. And so talking to someone who's trained and would sit down with you and go through how things are feeling and try to work out where perhaps this has all come from. And that's Talking Therapies. It's a free service on the NHS. What do you think about that?
Obviously, I'd want to start at the less drastic end and move upwards, so we reserve medication for option 3.
Yes. That would suggest to me that perhaps Talking Therapies could be a really sensible approach for you. I'm going to provide you with contact details for the Talking Therapy service, and we always say to patients, look, it's over to you to contact them.
Yeah.
We will be arranging a follow-up appointment for you after today, just to see, well,
changed?
Yeah, where are we? What's changed? What's different? I'll ask my admin team to arrange that appointment for you. There we go, Graham. A few ways in which you can contact them and the kind of things they offer there. Thanks for coming in.
Thank you.
All right, we'll see you in about 2-3 weeks' time.
Thank you very much.
Take care.
Oh God, whose hair's that? Is that my hair? On the back of your chair? That is disgusting. Is that my hair? Can you see it? I think it's mine. God, I'm molting. my hair's falling out. Oh God. I'm gonna be bald.
Hello, come have a seat. How are you today? Tell me, how can I help you? Hello, come on. Yeah, you come in. Yeah. Mums are allowed, yeah, if they're okay with it. Yeah. Tell me, how can I help you?
I've been told to come to see because I noticed when I had my 24-hour ECG, they found some problems with my heart.
Let's have a look. Okay, so you had an EEG, which was abnormal.
Yeah.
Confirming the diagnosis epilepsy. You were put on levetiracetam.
Yeah.
Keppra, yeah? Is that helping you? No more seizures?
So far.
So this is basically a first-degree heart block, which we tend to see in some patients. I'm just going to check your pulse, if that's okay with you. Thank you.
I have noticed that the more she is tense, the more
Seizures?
seizures.
Do you think it's right?
Yeah.
What are the triggers you feel that you...
I don't know, like 1 minute I'll be fine, the next minute I'll just be laying on the floor and then I'll lose consciousness as well. And then I'll come back around.
How you getting on?
Well, some days better than others.
How's your anxiety?
Calming down. I'm a little bit calm today, but I've had a bad morning. I say really bad.
My anxiety attacks are coming back.
Okay. And tell me what happens when they come along.
Well, I'll just go all hot and cold, sweats and that, and I'll just start panicking. And it's really bad panic and all, like, I can't breathe hardly.
Sometimes I feel like I'm anxious.
Yeah.
I get really, like, agitated, really, like, panicky for no reason. I, like, my mood just changes. Next minute I could be all, like, bubbly. And the next minute I'm having, like, a come down and I'm, like, taking it out on people.
Think there's a bit of light at the end of the tunnel?
I hope so, yeah. I really do, yeah.
Well, that's better than where you were.
Yeah, absolutely, yeah.
Is that what's causing you the increased anxiety or panic, or is there any
Not really
underlying...
sure.
Yeah.
I think so, yeah.
Are you socially very anxious?
Sometimes, yes.
Doing your work
Yeah.
and things like that, yeah. Let's have a look.
So I was put on Propanol and
She put quite a lot of it.
Yeah, I can see that. Gabrielle stopped her antidepressants thinking that they were the cause for her seizures, but later it was confirmed that she had epilepsy and was started on anti-epileptic medications. Now that we know that these medications are not the ones that are responsible for your seizure. We can restart one of them called citalopram at a very small dosage of 10 milligrams. That is used for anxiety as well as depression. You could see how it goes with that.
Okay.
Prescribing in multiple medical condition can be a tricky issue. It's not an exact science. It is based on what's out there in terms of the research evidence and the patient experience and our own experience of having prescribed in the past. It's a triangulation of all these three that would help us issue the right medication to patients. There is another medication called venlafaxine. The mention here is use venlafaxine with caution in the history of epilepsy. So most of the antidepressants, or perhaps all of them, will have that kind of effect. But you haven't tried that. Yeah. That's something that I'm happy to issue that for you and see how it goes. It's once daily, and you can see whether that will help you. Yeah? Okay.
Thank you very much.
All the best. All right?
Thank you.
Take care.
No one speaks Polish.
Oh, I got told that I look Polish, but I don't speak it.
Very helpful.
Oh, just letting you know.
John Condomiti, please. Hi. Hello, come through. Have a seat.
Hi.
Hi, how can I help?
My problem at the moment is for the past few days, it felt like I had trapped wind right up in quite a large area. But now, even though it's not as great, I still can't reach the top end of my breath. It's hurting all on the right.
Okay. And what do you do for a living?
Construction.
Right. I was looking at your T-shirt thinking...
So, no, I'm qualified as one.
Right, okay. Going to put this on your finger to start with. Have you had a cough or cold in the recent few weeks? No? You've otherwise been quite well.
Health-wise, I'm pretty good.
So listen to your chest now. Point to me where it was hurting you when you took a deep breath in. In fact, can I lift this up when you do that so it gives me an idea?
Yeah.
All right? So take a deep breath in and out. Whereabouts? In there. Okay, you can relax now. All right, I'm just going to tap on your chest now. Listen to your back. Do the back now. That's great. Okay. So, is it tender when I push on the chest wall here?
No. So I'm thinking that it might have been a rib.
When I push on those ribs there,
yeah.
Is it causing you any pain? So the pain is when you take a deep breath in, it seems to be catching, is that right?
Yeah.
So do that one more time. Okay. It almost sounds like what you have is something called pleuritis, where something is rubbing between the membranes that cover the lung. Now, why this has come on now is very difficult to pinpoint. I mean, I did do a check and your lungs sounded clear. Your oxygen levels are really high, so 99%, which is good. So, you know, one of the other reasons we tried to exclude is something like a blood clot, but that does not seem to fit with you. Obviously, if you suddenly find you're really, really out of breath and it's severe pain that's different to what you have now, then you do need to seek medical attention. For the time being, just take it a bit more easy this week.
Obviously, you need that rest, so kind of.
I can give you an anti-inflammatory that's stronger than ibuprofen, or you could stick to what you're taking. What would you rather?
I'd rather take something stronger.
Stronger, okay.
Right, thank you very much.
All right, nice to see you.
Yeah.
Bye-bye.
Takes me over an hour and 2 buses to get here. I'm not bloody well coming back again. That's not it. It's going to take me 2 buses now to get... You know, it's hideous. Once upon a time, I could get the bus outside my door and bring me right round here. Yeah. I tell you, they want us all to die, don't they? I've lived too long, that's the problem.
Well, you're looking good then.
Well, as I say, while I've got clothes on, as they start coming off, you see the years, I get worse and worse and worse, I can assure you.
Safi, she's been quite poorly.
Yes.
Really bad sore throat.
Yes.
Her runny nose just started today, temperature.
Yes.
Just coming down with paracetamol, but I just wanted to get her checked out. She's coughing constantly.
Of
She's
course.
kind of,
No worries.
I don't know if it's tonsillitis or what. I'm a little bit worried.
No trouble, we'll get it all checked out. I'm just going to jot some of these things down. I have to ask, Mum?
Yes.
Have you come this way for me? That's fine. Pop your finger in there for me. Finger in there. Lovely. Let's put that into your ear. Have you had this done before?
Yeah.
Lots and lots and lots. All right. Any earache?
No.
Okay. Open your mouth as wide as you can for me. Very good, okay. Stay there for me. I'm going to press here. I want you to tell me if there's any soreness here. Is that painful?
Yep.
Is that very sore? Do you suffer with tonsillitis?
I have before.
Stand up for me. And just pop your jacket off for me. And if you turn around to your mum, nice big breaths in and out. And out. And again. Lovely. Grab a seat for me. Okay. Good things, guys, good things. So, your temperature's perfect.
Oh, good.
Your heart rate is perfect.
Okay.
Your oxygen level is perfect. So all those are good things. Okay, your chest is clear. You've got good air entry on both sides. No crackles on your chest, which is good. The throat is red, but there's no pus at the back of the throat, which is important. Your glands are up, so I can feel that's what's sore.
Yeah, she did say.
The likelihood by far is a viral infection. Antibiotics won't work, unfortunately. There's no magic cure. 7 to 10 days. Important things when you get a temperature, paracetamol, when your temperature down, plenty of fluids, and time. Does that all make sense?
Yeah, it does. Okay, that's good. I probably have the rest of the day off today then. Thank you very much.
No
Doctor.
trouble, no
Thanks.
worries.
Bye-bye.
Bye-bye now.
I'm telling you now, girls, and I'm telling you, I would not order myself a triple vodka.
So who ordered them for you?
Pam.
She's naughty.
She can drink that much, I can't.
Well, I don't know, she gets pretty drunk herself.
Yeah, but she came in on Friday and she said that she was rough. Mate, she had her hair done, makeup, everything. I came in, right? Hair was like this. I had Thursday night's makeup on. Still, I was rough.
Come and take a seat.
Oh, it's a big room.
Yes, come in. How can I help you, Miss Embry? How can I help?
It's my legs.
Okay, what's wrong?
It's really painful.
Okay, which part is painful?
It's round here.
On the skin?
Yeah.
Describe the pain. Is it a burning pain? Is it a dull pain?
Really sharp pain. I was in agony last night.
Looking on the system, it looks like you've got arthritis of the knees, haven't you?
Yeah. But I've got these painkillers.
Yeah, let's have a look.
I've got them.
Oh, lovely. Yeah, so that's your normal medications.
I've got them.
That's for pain, yes. How many of these do you take a day?
They told me last night to take 3 of them instead of 2. But I was in such agony last night.
I've got the documents here. I think one of the doctors said the neighbours saw you coming off the bus and you were crying as you entered the house. And you were complaining of pains in the legs, so they called 111 for you.
And I said to the doctors, I said, I feel like having them chopped off.
Oh, no. No, don't say that, Gloria.
I was in such pain.
How long has this problem been going on for?
For years.
Let's put some gloves on and check your legs. Do you put any cream on your legs?
No.
Because they're very dry. Because if the skin becomes quite tight, that can also cause pain. Can you feel me touching you here?
And it hurts. That's it. That's where it hurts.
Here?
Yeah.
On the front?
And around the back as well.
Okay. Is this the normal size of them? Are they a bit more swollen than normal?
Yeah.
They are? Pop those back on.
I've got some cream.
Yeah. So I might have to give you a stronger cream. And I think the doctors are right that saw you yesterday. You need to take 3 of those tablets instead of 1.
Yeah.
Have you ever had a water tablet before?
Don't think so.
Okay, let's have a look. So what we're going to do is I'm going to give you 1 more tablet today. It will help shift some of the water off the legs, okay? I'm only going to give it to you for a week, and then I'll get the nurses to come out and do a blood test. How does that sound?
Yeah, fine.
Okay, so let's do that as well. And I'll give you a special ointment for your legs. Okay? Apply the cream once or twice a day. So the water tablet is 1 a day in the mornings, okay? And I'll get the nurse to come out and make sure things are okay as well. All right, take care.
Okay. Oh.
Let me help you. So the lift is just next door. Take care. Take care, Gloria. Take care. Bye.
Oh my gosh, was you in the other day when her son came in? And she went to him, oh, give us a kiss saying goodbye. So he went and give her a kiss. I went, oh, give me one too. I didn't expect him to come in.
And he went.
One. I was like, oh.
How old is he? 17. Oh, I bet he did. Of course he went in for one.
I need candle. Hello. Come through. Have a seat.
Mr. has a very bad cough and a very bad sore throat, it seems.
Okay, tell me, when did it start?
Oh, I've had it on and off for a week now.
Okay.
We're struggling to feed him, basically.
Okay, and how's the breathing?
He's got a floppy windpipe, so his breathing's going to be erratic, and he's had a viral ever since he's been 6 weeks.
So there's been no change in his
No
breathing?
change at all.
Okay. And how long has he been feeding the way he's been feeding?
It's been about a week.
Any temperatures at all?
No, I don't think you've done smelly. I can smell it. Thank you, son.
Is he having wet nappies? Yes. Okay. All right, let's check him over.
Yeah, that's fine.
We'll start off with his chest and then we'll do his temperature and
Yeah, that's
and
fine.
his ears and throat and things.
No, that's fine. This little man has everything. He's got that.
This has only just started coming back up again.
Okay.
It did go down a bit.
So quite a big noticeable difference, isn't there?
Just a tad.
So it's making you scratch and bleed, isn't it?
Rip the skin off me.
Okay.
Did you have any exposure to daylight at all for hours or anything like that? Not necessarily sun, but just daylight.
No, not at all.
Very inflamed, very angry. I think maybe a touch of some steroids might help with that, some hydrocortisone.
Okay, do you want to bring him over here? Sure. Just leave him the way that he is for the moment and we can check him over. Okay, so just one hand across here and one hand on his forehead here. That's great, perfect. So if you sit him up, it might be easy if you put one hand across here and one hand on his forehead. That's perfect. Oh, little man. Oh. Okay. Does he bring up a lot of his feed?
Yeah. He's on Gaviscon.
So I think what he's got is something called bronchiolitis. It's a viral infection, combined with the fact that he's not feeding as he should be.
Yeah.
And the fact that he's so young. I would like the paediatricians to review him.
Hospital?
Yes.
Who are you looking at?
Hi there, my name's Dr. Deary. I'm a GP from Farnham Road Surgery. I've got a 15-week-old boy I'd like you to review for me, please. Sounds like he's got bronchiolitis. My main concern is Mum says he's not been feeding. On examination, he's afebrile, respiratory rate of 48, heart rate's normal. Thank you so much. Bye. Right, there you go, Mum. All the best. Take care, right? Like I said, it's just to be cautious and for monitoring. Let's see how she gets on, all right?
Tell me, Phil.
I tell you what I did like, and it was a vegetarian dish. It was halloumi. The halloumi in the wrap. That was quite nice. I ate in there once.
Halloumi from Nando's?
Yeah.
They're famous for chicken, and you go and have vegetarian.
Yeah, I'm not a big meat eater.
Oh, I am. I'm so greedy for
And
meat.
they don't do fish.
So, butterfly chicken, sweet potato.
Come in. Take a seat. Is it Brotham? Brown?
Rome.
Brome.
Yes, as in Rome, but Rome.
That's interesting. Where's that from? Which part of the country is
Lake
that?
District.
Lake District. Which part of Lake District?
Oh, there's a village and an abbey, and
Is it an actual village called Brome?
there was, yes.
There was.
I think it's mostly disappeared now.
Where is it in relation to Keswick and Windermere?
Yeah, in the Kendal area.
How can I help you?
Well, I had an X-ray taken on my wrist.
Yes.
Damaged it 2-3 weeks ago now.
Did you fall or something?
Yes. I
Mhm.
fell on that arm, and it's still swollen up. I've had it X-rayed, and the result was supposed to be in today. That's why I've come. It's still very sore. I
It
can't put
says
weight on it.
no acute bone injury demonstrated.
That's right. No fracture, she said.
There is significant degenerative change, which basically means arthritis. Okay?
All over. It's still very painful. I can hold an empty glass, but a full one, no.
Just relax.
Because the arthritis doesn't help.
Yeah. When we pass 21,
Yeah.
things start to heal a
downhill,
bit
yeah.
slower.
Yeah,
And
I know.
my hunch is that did you fall?
Yeah.
Yeah.
And I felt like
That you've I mean, I suspect it's a lot of soft tissue injury. It's not bone.
not bone.
And it's actually just a nasty sprain. I tell you what, I'm going to give you some naproxen for a couple of weeks, which I want you to take with food,
Yeah.
a small dose, because you are 88.
Probably time I departed this mobile mortal.
Well, I don't think that's true. For one thing, you're still compos mentis, you know. Aging is not easy.
No. No, tell me about it.
Because we've got healthier, the course of your life expectancy has done this. I mean, when you were born, you know, I mean, you're a year younger than my grandmother.
Oh, really? My grandmother lived to be 90.
Yes.
Yeah, and my grandfather was about 85.
Were they all Cumbrian?
No, they were from Liverpool.
Oh, okay.
Ah.
Right.
So I'll
Take this
take that.
morning and evening with food, just for 2 weeks,
Yeah, okay.
and then see how you go. Come again if you're worried about it.
If it's no
Okay.
better. Yeah, okay, thank you.
Show you to the door.
The knees, you know.
Take it easy. Bye bye.
Thank you very much.
Bye bye.
And we can catch up in 2 weeks' time, see how things are.
Take care. Good luck with everything. Bye.
Thank you very much.
Perfect. Okay. You take care. Bye-bye.
She wants to go home.
Yeah.
Yeah.
Thank
Bye-bye.
you very much. Bye.